Good morning. Thank you for listening to Community Access. My guest today is Dr. Abbas Mohammadi, founder of Columbia Dental. Good morning, doctor.
Good morning, Alison. How are you?
I'm well, thank you. How are you?
Excellent.
So you recently had another free teeth cleaning event.
Correct.
That was on April 6th.
Yesterday, yes.
How did it go?
It went very well. We had many people that they came, and we are grateful that we could serve them and provide the cleaning for them.
About how many people would you say turned up yesterday?
Maybe 25 to 30 people.
Wow. Wow.
Yeah.
That's amazing. How many years have you been doing the free teeth cleaning? Is this the first year you've been doing it?
Not really. We doing through all the year. We did on Thanksgiving. We did on Christmas Day. We did on Memorial Day. We did on July 4th. Usually we do on every major holiday that people they are off, and we feel that we have to give back to the community. We do so, but because now this year is our 25th year anniversary, we give one more extra event to our agenda.
How nice. So if it was about 25 people and you've been doing this over and over and over, that means hundreds and hundreds of people have received free teeth cleanings. People who don't have dental insurance or don't have the money. It's been a huge blessing for them to come in. And so your workers actually come in on their day off.
Well, we don't have, the culture of Columbia Dental, we don't have a day off. I mean, there are, of course, not everybody works 7 days a week. I do, but not everybody. But our practice is open. Columbia Dental in Manchester, we are open 365 days a week. So regardless, we are open for any emergency or for any urgent care, especially on the major holiday. But Sundays, we perform even a lot of elective procedures because it's the day that people they don't have anything to do, they don't have a work, so they are busy during the week. So we provide services for them.
So then, forgive me, people didn't have the day off. You just make sure that you have people working 7 days a week just in case anything happens.
Yeah, we are open anyhow. But of course, when we had that event yesterday, we called three of our nice hygienists to come and work, and they were very nice to accommodate those 25 to 30 patients that we saw yesterday.
That is so nice. So 25 years, doctor. What has dentistry been like years ago compared to now?
Well, is things had been changed a lot. I can tell you, is was beyond imagination. Remember, old days we have to take the X-ray, radiograph, process the film. We have to wait like at least 5 6 minutes to process the film to see the X-ray. These days everything is digital. I remember we had file to look for the patient names. Now everything is digital. So technology had changed a lot. The dentistry things are getting way more efficient, way faster, and much better. And the quality also, by using the technology, it become more precise, more accurate. So not dentistry, it become faster. Also, it become the quality. It much better because we're using devices for accurate precisions.
I know myself over the years, I wouldn't embrace technology. I was afraid of it. I wasn't sure I'd be able to utilize it. How do you feel about it? Was it difficult at first and then you got used to it, or it was just an easy transition for you?
Well, nothing is easy. Any changes is not easy, but there are times, just giving you the example, we keep adding, offices, and then we realize at one point, the software didn't handle that wide range of networking, so we had to change the software during, this is that was back in 2015 or 16, because my server, it kept crashing. Those are unintended consequences that you do because nobody else did it. I was one of the first dental practices that wanted to operate the networking in a wide range of networking. And so everything was okay until I have like a 3 to 4 offices. But when we start to open more offices, we saw that the software is keep crashing. So I had to change the software. I have to change all the computer infrastructure. That was very painful, don't get me wrong, but it's the best things that could happen to you if you can get that painful grow and transform it to expansion. It is what it is. That's life. You're not going to grow without having pain.
That's right. That's very well said. Are you doing anything to celebrate the 25 years?
Celebrate, yes, we're going to have like an in-house party in one of the local restaurants this, the coming Saturday, and employee, all the friends are we getting together.
Did you ever think you would be this long?
Yeah, always I thought that's a long journey, and I'm looking for the next 25 years.
What do you hope for the next 25 years?
Well, I know dentistry is probably is going to evolve a lot again. I think the technology is going to take control or take a part of the routine dentistry that we do. What I learned through these years, technology is going to replace the dexterity. So I do believe, like right now in our dental laboratory, we use milling machine, printing machine to make the our prosthetics. Before was a lab technician was sitting on the bench and was an artist that was doing the making the prosthetics. So by bringing technology, there is no need that much of dexterity. Still the art need to be implemented, and technology cannot definitely replace the art part of it. But right now we bring in the technology and the art together to fabricate or making our dental prosthesis. So what I see in the next 25 years, these technology also is going to take over of some of the procedure that the dentists they do, not the lab technicians. So I can picture that maybe in 25 years or 30 or 40 years down the road, not the dentist does prep for the crown or do the fillings or prep the tooth. Probably a robot would do it, probably a dentist sitting on the computer monitor and try just to watch or control the preparation part of it, because I do believe robot is a way more precise than human.
Wow, that's interesting. I think of the Jetsons.
Yes. They more accurate, they're more accurate, they are less prone to mistakes than the human. So I do believe not only in dentistry, obviously, I do believe that a lot of in even in industrial or healthcare, everything would be replaced by robot, because they are more precise, they are more accurate, they are faster, they can work 24 hours, around the clock.
Yeah, they don't get sick. Yes. They don't have fights with their spouses. They don't have bad days.
That's correct. But they do crashes, and but still, is they are more accurate.
So, with these new tariffs, do you think that it's going to have an effect on your business?
Well, talking about the milling machine and printing machine, and a laboratory, part of a big overhead in dentistry is fabricating the dental prostheses, like making the crown, dentures, and so on. So we used to have a lab technician before COVID, or maybe before COVID, that we fabricated the dentures, the crown, all dental prostheses in our own house laboratory. But then sometimes around maybe 2014 or 15, we downsize our dental laboratory because to send those prostheses overseas was way cheaper than having a lab technician here to fabricate it. So it cost us way more money, let's say, for example, to fabricate a crown in our own dental laboratory rather than send it overseas to China or to Philippines and so on. So we downsize our own dental laboratory, and we try to send it overseas to fabricate. But then we got the COVID back. When COVID, and we didn't have not all the few lab technicians that we had, they laid off, and then was very difficult to send it because everything was in hold, no transportation, everything, all the border was closed, and so on. So that was the time that we implemented technology, digital technology in our laboratory, and we fabricate everything in house. So make a long story short, because of that, I don't think this current tariff is going to affect that much our practices. So it's going to be the same because we already, what they wanted to force everybody else to bring the business back in the United States, we have done it like 4 or 5 years ago.
Wow, that's wonderful. One last question for you. If you
Sure.
could just tell me some of the other specialties you do besides general dentistry.
Sure. Columbia Dental is the only private practice in Connecticut that has all the 6 different disciplinary, including pediatric dentist, prosthodontist, periodontist, orthodontist, oral surgeon, and endodontist, that means root canal specialist, and periodontist, which means gum specialist, in one roof.
Wonderful. I'm speaking with Dr. Abbas Mohammadi, founder of Columbia Dental. If you'd like to hear about these services and more, go to columbiadental.com. Doctor, thank you so much for being
Thank
here
you
today.
so much. Thank you.
You're the best.
Thank you.